Okay, picture this. You're in an emergency room. It's chaotic, right? Alarms are going off, people are moving fast, and someone is really struggling to breathe. In moments like that, doctors can't afford to guess. They need a roadmap, a clear, step-by-step guide to get them from chaos to a solution. And today, we're going to break down one of those exact maps.
So that's the big question we're tackling. What do you do when a lung collapses? How does a doctor, in the middle of all that pressure, make the right call? We're going to walk through the decision-making process, a clinical flowchart that turns a really scary situation into a series of clear, logical choices. Let's get into it.
All right, first things first. Let's make sure we're all on the same page. The medical term is pneumothorax, but most of us just know it as a collapsed lung. And it's pretty much what it sounds like. Air leaks out and gets trapped in the space between your lung and your chest wall. That trapped air creates pressure, and it literally squishes the lung, making it collapse. Kind of like a balloon with a slow leak. Understanding that basic idea is key to everything that follows.
So our journey is going to follow the exact same path a doctor would take. We're going to use this guide to see how they look at a crisis, ask a series of really smart questions, and end up with a clear plan to help their patient.
And here it is, the whole shebang. Now, I know what you're thinking. It looks like a complicated mess of lines and boxes, right? But trust me, we're going to break it down step by step. The beauty of this thing is how it takes you from that one single starting point at the top, guides you through a few key questions, and leads you to one of 4 clear outcomes at the bottom. It's really a masterclass in turning a crisis into a clear plan.
So let's start at the very top of that map. You know, any good investigation starts with the first few questions. And in medicine, those first questions are absolutely everything. They set the entire direction for what's about to happen.
Okay, so put yourself in the clinician's shoes. Someone comes in and you suspect a collapsed lung. The very first thing you need to figure out isn't how big it is or what caused it. It's simpler than that. Does the patient have symptoms? Are they having trouble breathing? Do they have chest pain? Are they in distress? Yes or no?
And you can see right here, this is that first major fork in the road. It's a simple question with huge implications. If you follow the chart and the answer is no, the path is pretty straightforward. It points you right to something called conservative care. We'll talk about what that means in a bit. But if the answer is yes, well, that's when a whole new set of questions opens up, and we've got to dig a lot deeper. So the patient has symptoms. Now the alarm bells are ringing a little louder. You immediately have to figure out just how bad this is. This next question is like a filter, sorting out the patients who are doing okay from those who are in real, immediate danger. And these are the big red flags the doctors are looking for. Each one of these seriously ups the stakes. Take hemodynamic compromise. That's a fancy way of saying their blood pressure is tanking and their heart's not keeping up. That's a true life or death emergency. Bilateral means it's happening in both lungs. And if someone already has a lung disease, they just don't have the backup to handle this. These aren't just details. They're giant warning signs that scream for immediate, more aggressive action. Okay, so we've checked for symptoms, we've checked for risk factors. Now the flowchart brings us to the practical side of things. Before you do anything, you have to know what you're physically working with. Now, this might sound a little strange at first. You'd think if a patient is high risk, you just jump in and fix it, right? But you can't. You have to ask, is the pocket of air actually big enough to aim for safely? If you try to stick a needle or a tube into a really small air pocket, you could end up puncturing the lung itself, making things way worse. And there's actually a pretty clear clinical rule of thumb for this, which is super helpful. Doctors are generally looking for a collapse that's at least 2 centimeters wide on a chest x-ray. That gives them a safe margin to work with. If it's smaller than that, the next step is usually to get a CT scan for a much more detailed look before making any moves. Okay, now this is where things get really cool, and it's what I love about this chart. It's not just about the science, it brings the patient into the equation. Once the doctor knows it's safe to do something, the next question is basically, okay, let's talk. What's most important to you right now? And that conversation leads to one of these 3 paths. Priority A is for someone who says, look, I want to avoid a procedure if at all possible. Priority B is for the person who needs to feel better fast, but really wants to avoid being admitted to the hospital. And priority C is for the person who says, just do whatever works best and fastest, even if I have to stay here for a bit. That choice really steers the ship for the next and final step.
So, after all those questions, symptoms, risk, size, and patient priority, we finally get to the bottom of the flowchart, the action plan. All those different paths all lead to one of these 4 distinct treatment options.
First up, we have conservative care. This is the destination for those patients with no symptoms or the ones who told us they wanted to avoid a procedure. It's basically watchful waiting. The body is amazing and can often fix a small collapsed lung all on its own. So the plan is simply to keep a close eye on them with follow-up appointments to make sure the lung is slowly reinflated.
Next up is the ambulatory device. This is that perfect middle ground for the patient who needed relief but wanted to go home. They insert a small device, often with a one-way valve, that lets the trapped air out but doesn't let any new air in. It's brilliant, really. The patient can go home and live their life while the lung heals itself over a few days.
Option 3 is needle aspiration. Think of this as the quick fix. The doctor uses a needle and a syringe to just manually pull that trapped air out of the chest. But here's the key. This step has its own little decision tree. Did it work? If yes, great. The lung reinflates and the patient can usually head home. But if it doesn't work, the flowchart has a backup plan. It sends them on to the next, more intensive option.
And that brings us to the final and most intensive option, the chest drain. This is where those high-risk patients end up, or the ones who tried needle aspiration and it just didn't do the trick. A flexible tube is placed in the chest, and it stays there, continuously draining the air out until the lung is totally healed. This one does require a hospital stay, but it's the most surefire way to fix a serious collapse.
So we've walked the whole path, from that first simple question all the way to 4 very different treatments. Let's just zoom out for a second and think about why a tool like this is so incredibly powerful in medicine.
So when you boil it all down, what does a flowchart like this really do? It's so much more than a checklist. It forces a systematic approach, so nothing gets missed in the chaos. It builds in a critical safety check, that 2-centimeter rule, before anyone does anything invasive. It makes sure the patient's voice is actually heard in the decision. And in the end, it guarantees the treatment isn't just a random guess, it's the logical, custom-fit conclusion to a really careful process.
And that kind of leaves us with one final thought. In those critical moments, when someone is struggling for every single breath, a flowchart like this isn't just paper. It's a lifeline. It's a clear, proven path that cuts through all the noise, reduces the chance for error, and makes sure every single patient gets the right care for them at the right time. It is, quite literally, the tool that creates clarity out of chaos.